Good morning, everyone, and welcome to the webinar. This is the final wrap-up for OEP. Let's get started. This is our 2023 Ohio and Kentucky ACA OEP check-in. All systems go, so here we are. Just a little housekeeping. And you know the drill. If you got a question, put it in the chat box to the right, and we'll get to those questions at the end of the presentation. And I do want to make a quick shout out. We are so thrilled and devoted to our loyal agents and brokers. And we understand last 10 years, and this is the 10th year of the ACA, the industry has gone through a lot of changes, and it's through you know, our collaboration with our agents that has driven this transformation for us. So we are delighted to have you on board today, and I just wanted to give you that that declaration. So the next piece of business, here's our information. Check out my email address, my phone number. Eric is on hand. Let's get started. I want to talk about the ASP program real quick. As a Cornerstone broker, you have access to expert services from our agent services program that can help you customized plan for you based on your specific needs to ensure that you and your family are covered. Contact us today to learn more about it. There it is on the website. Check it out. Autopilot, parachute, and flight plan. For downloadable social media images to customizable flyers, Cornerstone's Marketing Hub has what you need to start managing your marketing in-house. You can access the Marketing Hub through the Cornerstone Resource Center with your username and password. Call Jess Larkin, and she can tell you. Is jlarkin@crnstone.com, and give her a call or send her an email. Let's get right into it. OEP starts November 1st, next week. So, and I've been informed that the rates actually went live just 20 minutes ago. So we've been waiting, but now apparently rates are out there on healthcare.gov, and open enrollment runs from the 1st of November through January 15th. And as you are well aware, that involves getting FFM certified, and this is live. It's for new and returning agents, and I'll just hover over this real quick. Everybody will get a copy of this presentation, and here the presentation will have the link, the hot link. In this case, it's portal.cms.gov, and everybody will get a copy of this with the to the necessary areas. So if you're not certified, you're going to click on new user. If you're already certified, you want to click on the refresher course. Keep in mind the password needs to be changed every 90 days, and then you can verify it also by clicking on this link here. Okay. Also, shout out to Help on Demand, which is a really cool referral tool that CMS has created. Help on Demand is a real-time consumer assistance referral system that connects your consumers with agents, and only agents and brokers who have completed marketplace training and registration are eligible. Agents and brokers who are appointed can access the information regarding Help on Demand using this link here. And again, this will all be sent out to you later in a subsequent email. So there it is. And I want to toss it over Eric while I go on mute. He's going to talk about the short.
Yeah, thanks, Geoff. So here we are again, back to enrollment, and our tool called Sherpa. It is the largest ACA tool to use to quote for your clients. It has a lot of benefits. The main thing this year is multi-factor. This all can be completed if you go through your settings tab on your current Health Sherpa account. You scroll down a little bit, and then it should walk you through the steps once you hit enable on your current Health Sherpa account. You scroll down a little bit, and then it should walk you through the steps. Also, you can upload your documents for your client straight on also, you can track any your documents for your client straight on all your reporting and analytics. Track any client activity, NPN overrides as well. Here again, just a little bit of a description of the multi-factor. So CMS is requiring partners like Health Sherpa to set up additional authentications for your brokers, just so we stay safe and everyone's information is retained just to you and nobody else can get in there. This will take effect September 1st. Well, I guess it already has. But they're going to start implementing that, and then you have to get ready through that change in mid-August. So if you haven't done so already, go ahead and get this done. And then once again, Health Sherpa is free to you. You just give me or Geoff a call, and I'll get your account set up. Once it comes in, I'll get a link sent to you. If you have any trouble with that, just call me. We do have some where you run in and you're stuck on a specific carrier. I do have a workaround for that, so we can get that fixed. And there's no issues there. That way you can see all carriers and everything's right there in front of you. And then lastly, well, two things. We have this is the plan comparison. We've seen that it's probably best when you go to compare these plans. Just take a screenshot of this, and you can send this to your clients. And then if they see a plan that they're interested in, then go into depth with it. But they also have a send a client where they can actually go and see this screen as well. So that's another option to use. And then now we have some metrics on Health Sherpa. 63% of people are getting a CSR here. Your average median range there for your ages is about 48. And then most of our clients are 40 to 59 years old there. That almost takes up 50% of everything. So. And then now we got, I'll go back to Geoff.
Yeah, as you well know, I'm old school. I like the old headset with the microphone and whatnot. And I do want to talk about the current environment for the ACA. And major changes took place about 2 years ago with the American Rescue Plan. And some of you already know about this, but the subsidies that are being offered are substantially larger now. And this was stemming from the COVID-19 health emergency that is actually still in place. So they sort of renewed that health emergency for the next 90 days. But the long and short of it is 4 out of 5 enrollees can find a plan for $10 or less after the premium tax credits. And in fact, more than 50% can get a silver plan for less than $10. And this is primarily because they've eliminated the subsidy cliff. And I just want to dive into this a little bit. This is the primary change that took place 2 years ago. In previous years, they had a hard stop at 400% of the poverty level. After that, you couldn't get a subsidy, but they've eliminated that, and so no one. The criteria is no one will pay more than 8.5% of their income for a benchmark silver. Okay, and these have been extended through 2025. So the ACA is here to stay. It's been here for 9 years. We're going into our 10th OEP, and it's here to stay. And here's an illustration of the subsidy cliff. I'm not going to give it too much time, but essentially in Ohio, for an individual, pre-subsidy cliff or American Rescue Plan. That's what this slide's all about. The subsidy was $179, and now it's upwards of $300 for a male age 50. And I'll just scroll down here to an illustration I put together. And everybody's seen this before. We've done this a couple times now. For a family of 4, parents are age 60, the children are, age 20. This was somebody who wasn't getting a subsidy in this prior arrangement, and now they get a huge subsidy, $1,300, and that resulted in a premium reduction for that family of 64%. So all the more reason to get FFM certified, and even if you haven't done it yet, give me a call, I'll walk you through it. It's not as hard as Medicare, I'll tell you that, having done that one. Okay, so let's have a public service announcement, and this is something everybody will be hearing in the news as time goes on. So this is an opportunity for lots and lots of prospects. This is called Medicaid Redetermination. Okay, this stems from the public health emergency from COVID in 2020. And essentially they put 15 million people more on the Medicaid rolls. And as this public health emergency winds down, and it is, right now it's slated to end January 15th, okay? America is back to normal. So the folks are going to be asked to come off the rolls. Essentially, they will lose their eligibility for Medicaid. And you're going to hear a lot more about this in the news. In Ohio, we think it's about 500,000 people. This does pose a problem because obviously the government's not going to just send everybody off of Medicaid all at once. They're going to stagger this and communicate with the clients. And get 30 days to learn about the disenrollment and find something new. I think what Ohio's strategy will be is to stagger this with different segments of the population, namely the folks who are about to turn 65, we can move those onto Medicare, and then folks who are turning 19, and then kids can go and get an individual plan on their own, just to sort of ameliorate the disruption of all these people being taken off of the Medicaid program. And you're going to hear a lot more about this, and by all means, this is a fantastic prospecting tool. It's not in place just yet. We'll hear more about this. I think this will all start taking place in other public service. The government did something about the Obamacare family glitch, and you're wondering, what is the Obamacare family glitch? Easy for me to say. So currently, an employer affordability is determined by the employee's cost only. So this relates to people on group coverage, whether that's affordable or not. And the problem is it didn't really factor in the family, okay, and what maybe the dependents costs were. Many times the dependents, spouse and children are not getting help from the employer on the insurance premium, and this impacted about 5 million people. And the solution is, instead of basing the affordability of a family's health insurance, employer-sponsored health insurance, on just the employee, it's now going to be based on the entire family. And there's more to it, and here's a link that is listed below. I'll be sending this out as well, so more to that as you learn about it. And we think this is, in round numbers, several 100,000 in Ohio are impacted. In reality, I think a lot of these people coming off the glitch, now eligible for individual, maybe these might be absorbed by better group coverage, but it also poses a big opportunity for you to sell individual. And the government has installed more software in the FFM application, the Obamacare application, to address this. So you'll have lines of questions asking about the employer affordability. And keep in mind, there's going to be maybe some more documentation needed, and but this is a big opportunity to perhaps sell more employer coverage, or I'm sorry, sell more ACA coverage, but it's all borne out in the application. And by all means, if you have any questions about the glitch and the resolution, just give me a call. All right, let's get to the heart of the matter, the 2023 ACA Market Footprints. This is where the rubber meets the road. We're going to go over the Cornerstone carriers and talk about their geographic footprints and their networks, and maybe a little bit about commission. So let's start off with Anthem of Ohio. Anthem is coming back into the Ohio market in a big way. They've been on the sidelines by and large for the last 5 or 6 years. They increased their presence somewhat last year, but this year they're in all 88 counties. They're in all counties in Ohio, okay? And they've upped their compensation to $18 a PM. And in addition to that, they have dramatically increased their hospital network footprint. So let's start with Columbus, okay? Columbus, it had Mount Carmel system, but now they've added Ohio Health. That's a game changer. So Anthem will have Ohio Health in the Columbus market, and that's about 5 or 6 counties in and around Columbus. And we anticipate a lot of movement towards Anthem as a result of that. We think we might be really competitive against MedMutual in that realm. And then I'll also add that in Toledo, they've added ProMedica. So in the past, they've had Mercy. They still will have Mercy up there, but now they've added ProMedica. Okay. And then let's talk about the other markets in Cincinnati. Always very strong. They have the Christ system and TriHealth and UC down here. And then we go up to Dayton. Okay. They've got Kettering, and they now have Premier. They've added Premier. So really great coverage in the Miami Valley. And then again, Cleveland, Northeast Ohio, not exactly their their bailiwick as it was, but they do have a metro system in St. Vincent up in Northeast Ohio. Okay, and there's other areas too. Give me a call, we can talk about it. And I've got more detail here in a little bit. So moving right along, and I want to talk about the Bluegrass and Anthem's footprint down there. So they've done some big work down here as well. They've added some new counties. They've added about 6 counties in the rural areas. They do have a good footprint statewide now, and they're pretty much in every county. And but more importantly, they are in 3 metro areas: Northern Kentucky, okay, Louisville, and Lexington. And in Northern Kentucky, they have St. E's. In Louisville, they have Norton, U of L, and Baptist. And then coming over here to Lexington, okay, they now have Baptist in addition to UK. So a really nice job there. Their comp has also been dramatically increased to $25 PM. And their primary competition is CareSource. So maybe look at those clients that had CareSource down there and have them pair up with Anthem. Maybe look and see if that's a better option. And Ambetter, who's always been a really good partner of ours, over the years. Here's a thumbnail sketch of what's going on with Ambetter. Okay, not a tremendous amount of movement. They are essentially, content where they are in the market. They've been very competitive statewide, and they did have one major addition up here in Northeast Ohio. But I need to mention, they have added university health systems up here. So Ambetter, traditionally in the more urban areas, and good compensation, $20 PM, and a couple more highlights on the networks, just so you know. In Cincinnati, TriHealth, Mercy, and UC. Okay, very similar to Anthem. And they do have Christ as well in Cincinnati. And in Cleveland, they have Metro, Lake, and St. Vincent. And I also mentioned University Hospital System up there. And in Columbus, they use Ohio State Network. Dayton is Kettering Network, and Toledo, they use Mercy, and St. Luke's and Toledo Children's. And these are based on a snapshot I did this past summer, always subject to change, and I want to emphasize that. So let's go on to Kentucky and Ambetter. Their primary focus is Northern Kentucky, Louisville, and Lexington, and they have, I believe they have U of L and Baptist in Lexington. I'm sorry, in Louisville. In Cincinnati, they have St. Elizabeth. I do want to call out that they've added about 15 to 20 counties down here along the Tennessee border. Traditionally, not a ton of population down here. They are very competitive with CareSource in this realm. So Ambetter is is again very competitive in Kentucky, and their compensation for Kentucky as well as Ohio anticipated to be $20 PM. Molina, they have decided to remain pretty much where they've been, and remain in the same county footprints for Ohio. Their offerings have been limited to some extent. A couple years ago, they withdrew from the bronze platform and remained on silver, and now they have reduced their silver options to a single, flagship silver option, and then there is an additional silver option, the government standard silver option. So clients will be migrated to the flagship silver option, and we anticipate, good renewals for them, good solid pricing, and commission $15 PM is what we're anticipating for them. And a couple of call outs on their networks. Cincinnati has the Mercy and UC system. Cleveland has Lake and Metro. Of course, Ohio State and Columbus, Kettering over in the Dayton area. And then in Allen County, this is Lima, they have Lima Memorial. So a good value add, and it's been popular over the years with many of our clients. In the Bluegrass, they're limited to 3 counties in the Louisville area, Bullitt, Jefferson, and Oldham. They have the Norton system and U of L. Okay. I do want to backtrack just a little bit on Ambetter. I want to verify the network that they have. I mentioned Baptist. I'll verify that for you, but in the subsequent slides that I sent out. And I need to make special attention, special call out to our new addition to the Ohio network, and that is UHC. UHC has been a player in about a dozen states so far in the ACA, and new for 2023, they are now in the Ohio market. And all of you have seen some of the invitations that we've sent out. They have tremendous compensation, $25 PMPM. That's the largest in the industry. And they are going to be in 4 metro areas, really 5, Cincinnati, Dayton, Toledo, Cleveland, and the Youngstown area. And just a couple of points on UHC in the Cincinnati area. They'll be using Mercy. In Dayton, they'll be using Kettering. In Toledo, they'll be using the Mercy system. In Cleveland, they'll have the Metro system, and then over here in the Mahoning Valley, they will be using the Mercy system. Okay, and I anticipate them to be near the top of I should say the enrollment price list, meaning they'll be among the cheapest plans. So they should appear first as the low-cost leaders. I'm not sure if they'll be number 1, but we can bear that out when we look at rates today and in the coming weeks. And CareSource, they are doing their platform rollouts tomorrow, I believe. So I don't have a ton of information on their plan descriptions and what they anticipate to do. We envision they will be standing pat. They will essentially being content to where they've been over the years. They've been a major player in Ohio with a lot of different hospital systems. In Cincinnati, their big calling card is they have the Children's Hospital system, and they do have good commission, $21 PMPM. That's what's been announced. And they're also big in Kentucky. Unfortunately, I don't have all the details on the Kentucky market just now, but they've also been a major player in the Kentucky market over the years. And then I do want to lastly touch on Oscar, and they've always been a good partner of Cornerstone's. Their primary focus is the 2 major metro areas of Cleveland and Columbus, and we've done this before. They really focus on maybe 1 hospital system in a given area. In the Cleveland market, it is the Cleveland Clinic, and they have the exclusive individual contract with the Cleveland Clinic. So if you're an individual prospect and you want to go to the clinic, Oscar is your exclusive remedy for that. So Oscar equals Cleveland Clinic. Just keep that in mind. And in Columbus, their partnership is with Mount Carmel, and there is the ability to upsell that product. They have what they call the choice product in Columbus, and with that, you can have access to the Cleveland Clinic up in Northeast Ohio. So that's a interesting combination. That's a really interesting and exciting development they've had there in the Columbus market. So comp $18 PMPM. And then as we kind of wrap things up here in the next 10 minutes or so and get your okay earlier, but here's a glance, and you can sites just dive in and see if these are real.
You just ignore. Just, I think it just
okay.
deleted it.
And here's the second page of that. Okay. As I mentioned earlier, UHC, Mercy, Kettering, Mercy, and Metro. Okay. So always verify on the carrier website. Just a quick shout out on dental plans for your individual market. Again, if you present this to your clients, half of them will buy it. So it's a pretty easy sell. And Anthem and Emeritus are somewhat of our bellwether plans for dental. They both have really good first dollar options, and they do have some out-of-network options. And in some cases, they waive waiting periods. And in the recent years, they've added additional services like orthodontia in both cases. So that's our primary focus, Anthem and Emeritus. And of course, Dental Care Plus has been a big option down here in Southwest Ohio. And you can ask me more about Dental Care Plus if you're selling down in this region. Delta Dental of Kentucky is another option that we offer. I wish I could offer the Ohio product, but unfortunately, today it's just the Kentucky market. And then Humana, they have a veterans package that's pretty cool. So those are your dental options. And then I want to talk about ACA Alternatives. This is plans other than Obamacare, and the primary focus here is short-term. And Golden Rule, our number one short-term carrier, is a division of United Healthcare. Keep in mind, it's different than the UHC ACA. So this has been a very popular plan over the years. Namely, it's a PPO as opposed to ACA style plans, which are always HMO. And they, in many cases have very competitive pricing, particularly if it's compared to a non-subsidized ACA plan or a low subsidized ACA plan. The one caveat is they do require you to go through underwriting. And National General is now Allstate. This is the latest iteration of John Alden, Time and Assurant. And the major development here is in Ohio, they eliminated all but the $7,500 deductible on this plan. So we have seen some business move away from National General short term and go to either a Golden Rule or Anthem. But they still have a great offering of plans. And I do want to emphasize, in Kentucky, they did not eliminate those deductibles. They are full on, full market. And what's more, in Kentucky, you can do a 3-year plan. And then lastly, Anthem Enhanced Choice. This is Anthem's short-term offering. Maybe a little pricier, but well worth looking at. In many cases, they don't pre-X. They just look at the underwriting and approve or disapprove, up or down, and they have more lenient underwriting than most, but might be a little pricier, but they do have richer benefits. They've got some nice first dollar benefits. And then I want to talk about marketing. This is what it's all about, marketing. So as you look ahead, and I know you're all into AEP and OEP now, but as we look ahead and continue to evolve our plans, I'm going to look at different segments. I think everybody right now is already looking at early retirees. Nearly a third of our clients are above the age of 55. And I would say close to 40 or 50% are over age 50. So folks are looking at retirement, and more people are retiring maybe 10 years shy of age 65. So this is a conversation that you can have with your clients. They need to bridge the gap to Medicare, and by all means get them thinking about other options, whether it be the ACA or short term or something like that. And obviously you want to think about other members of the family. Maybe somebody is on Medicare now, but what about the spouse? What about the kids? So these are good options as well for prospecting. More and more, we're seeing, somewhat of a turmoil in the under 40 clientele with regard to staying at a current job. There's been a lot of what we call job surfing for that segment of the population, also known as millennials. And these are a great opportunity for you to sell ACA because, as we are well aware, there has been so much upheaval in the last 2 or 3 years related to COVID and people coming in and out of the workforce. And I think there's going to be a lingering effect there for people under 40 who are finally settling into their careers. So Medicaid redetermination, I touched on that earlier. Another good prospecting area are college grads. Okay, people generally coming at graduation time this May and June. I'll be looking for a new job. I do want to emphasize new residents to Ohio and Kentucky, and it's a fact, people are moving back. So we've seen more and more people move back to the Midwest, the heartland, over the years, because basically the business environment is so viable here. So we're seeing more and more people move back with new industries. You think of the Intel factory going into Central Ohio, just a great opportunity. So I'm very bullish on the Ohio economy going forward, and as well as the Bluegrass. And lastly, a good target market are new families. I think everybody knows about that. That is a great opportunity to sell. And the one important thing to remember is these are 6 instances where you can sell this product, not just during OEP, but during SEP. SEP is that period that starts January 15th. So public service announcement about Autopilot. I touched on this earlier, but to reemphasize, Autopilot is our referral program. And it's a compensation-based program that lets you quote, enroll, support, and provide year-round service to clients that may fall off your business scope, but never off the radar. Under the plan, you can focus on growing your business with assurance that your clients will continue to receive the benefits of your market expertise and continue superior service and support. And our talented team will take care of your clients, whether it be individual, family, group, or Medicare. Okay, let's just touch on that a little bit. Let me dive into this a little bit. So this is the market footprint. Okay, and basically the I-75 corridor, and then some states here in the Midwest, and then we just added New Jersey. So shout out to the Garden State, New Jersey, new in 2023. We've got access to that state as well. And got any questions? Put them in the chat box. Let's take a look at these questions as we wrap things up. It is 10 after. Fantastic. So delighted to have everybody on board. Okay. Okay, hopefully the echo was resolved. Okay, by 9:39. Okay, so I apologize. My headset might have been the issue here. I do love my headset, but maybe that was the issue. So the first question is Cincinnati Children's in the Anthem network? That is not true. That is not the case. And reason being, Cincinnati Children's, like the Mayo Clinic, like so many other flagship, first tier specialty hospitals, they garner the highest reimbursement rates in the industry. And they have a lot of leverage when it comes to contracting. And in Ohio, their exclusive ACA insurance option is CareSource. And that remains to be the case for another year. We'll see what the future holds. We would certainly love to see some other carriers take on Cincinnati Children's. Okay, so I'm sorry about the feedback. Apparently it resolved itself early on. So another question came in later. Bronze for Molina? No, unfortunately no bronze for Molina. Thank you, Rod, for asking that, but I do want to point out Molina does not have bronze, and the thought behind that is the ACA puts a heavy emphasis on silver, so their thought process is with silver, clients might get a better option, better array of benefits, and that's their thought process there. So, and as a carrier, they have that discretion to choose what plans they want, but they do need to have a silver plan. And next question, I can barely read it. Yes, to reiterate, CareSource is the only carrier that has Cincinnati Children's in network. That's true. Okay. And then another item. As far as the short-term market goes, I failed to mention, there are some other carriers out there that do have short-term in Ohio, but of the ones that I can market that include Anthem, UHC, and lastly, Allstate National General. So those are the three that I can market, but you might find some more short-term options out there. Okay. Hopefully the echo has dissipated. If we are appointed for UHC to sell group, do we need a separate appointment to sell individual? That is a fantastic question. That is a very good question. The answer is yes. You do need a separate appointments. Please send me an email. I'm sorry for all the red tape, but yeah, you do need a separate appointment. And someone is asking for a screenshot of page 2 of the networks. And what I can do is kind of go back here and show you the networks again. Okay, we're going to wrap things up here in about 5 minutes. By all means, if you have more questions, having more topics you want to talk about, you want to talk about the ACA in general, or what the government is planning to do with redetermination or the glitch, give me a call. But I just want to hover over this screen and then this screen, okay, and then give you a lot of information. By all means, go out to healthcare.gov today and look at rates. It's like Christmas around here when the rates come out. It's like opening packages. We're really, Eric and I, we're really insurance nerds, and we're just like beyond crazy excited about looking at ACA rates and helping you forge your success with your marketing. I'll reiterate again. Can you summarize Okay, the question is, can you summarize what carriers have Children's Hospital and in what market? Okay, so if you're alluding to Cincinnati Children's, there's one carrier that has Cincinnati Children's, and that is CareSource. And there are some other very good children's hospitals in and around Ohio. I can touch on the Rainbow Babies Children's Hospital in Cleveland. It's also a world-class children's system up there, and they are under the realm of University Hospital and the University Hospital system, which we have with Ambetter. So a great option for those people in Northeast Ohio for children's hospitals. And the other thing that I think of is Nationwide Children's in the Columbus area, and I know for a fact that Oscar has them in network. So those are the two or three children's systems that I can think of in Ohio. Okay. Yeah. With that, I think we've rounded out most of our questions, and we're going to wrap things up for everybody. If you have any more questions, any more topics you want to talk about, we're here to serve. Getting into the nitty-gritty, Health Sherpa, or some of the other processes, the carrier enrollment tools, give us a call. That's where we thrive. And Eric, any last thoughts?
No.
Okay. Everybody, have a fantastic OEP. Have a great day.